For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good afternoon. I'm Hillary Armstrong, and I'm a Public Information Officer with the County of Santa Clara. Thank you for joining us today for a virtual media availability with Dr. Jeff Smith, County Executive. During the question and answer session, we will have an opportunity to answer questions. So you can raise your hand through the raise hand function, and the moderator will call on you and ask you to unmute. I do also see a question about allowing to record. We will try to figure that out on our end. You have our verbal permission to record, but we'll try to figure out any Zoom notifications that we need to do on that end. And we are recording the session and we'll be uploading it shortly after the media availability. We also will have the Public Information Officer, Ricardo Romero Morales, available after the English portion to provide a statement and answer questions in Spanish. With that, I am now pleased to introduce Dr. Jeff Smith. Thank you very much.
Hello, thanks for attending this virtual press availability. We're very happy to announce today a partnership with the 49ers and Levi Stadium to begin a mass vaccination site at the Levi Stadium early next week. We expect a somewhat soft start, hopefully Tuesday, where we will be targeting about 5,000 inoculations a day, moving up to 15,000 a day at our peak. This is an important step forward because we're going to focus on the age 65 and older population in our county and make sure that they are all inoculated as fast as possible. This new site is in addition to multiple other sites throughout the county that are now operating at a volume of about 5,000 to 6,000 inoculations per day, Monday through Friday, and about 1,000 on Saturdays and Sundays each. The new site will operate at hours that will facilitate evening vaccinations. So with that, I'll open it up for questions.
Thank you, Jeff. It looks like we have a question from Devin Feely, KPIX. I will allow you. Devin, are you with us? There we go.
Jesse.
Okay, so I've unmuted myself now. The county has posted a dashboard that kind of looks at some equity issues in terms of who's been vaccinated and the 170,000 doses that have gone out so far. There's been some inequities in terms of which communities those vaccines have reached. Increasing capacity doesn't ensure equity. So what are you going to do to make sure that more people get it, but also it's being distributed fairly and broadly?
Great and important question. First of all, the data that's currently on our dashboard starts from the beginning of vaccinations. And as you remember, initially there was direction to focus on the healthcare employee population and nursing home residents. So the majority of the vaccinations up until this point are focused in that population. So the demographics are a little skewed based on the demographics of the healthcare employee population. What we're doing right now is we're focusing on ongoing equity, and this mass vaccination site will only be part of the strategy. We also have local strategies in the communities where we're seeing the high positivity rates, which is mostly in East San Jose and South County. We have sites set up at the Mexican Heritage Plaza, at the clinic at the Tully Clinic in East County, at the fairgrounds, which will continue, at the burger site, all of which were accessible to East San Jose. Plus, we're setting up mobile sites. Next week, we will be at a Story Road location, and we are expanding to have home vaccinations for those individuals who are homebound. This is all in connection with a team that's multilingual and on the ground with information about vaccinations, as well as media spotlights and PSAs in multiple languages to try to focus on those communities in need. In South County, we have currently Gilroy Clinic, and we're expanding into the Gilroy Civic Center with a larger volume vaccination model. So we're trying at the same time as we're expanding volume to focus on equity and targeted audiences in need of vaccination that meet criteria of being 65 years of age and older.
Thank you. And with that, we'll go to Jesse Gary with KTVU. Apologies before, I'm unmuting you now.
Okay, can you hear me?
Yes.
Okay. Hey, Dr. Jeff, how are you? Thanks for joining us. I hear the goal of doubling, essentially, the number of vaccinations from 6,000 to 15,000, but how do you get the vaccine? I mean, you're not making the vaccine. It has to come either from the state or it comes from the manufacturers, but distributed by the federal government and the state. So how or what are you doing to try to get the number of doses up so that you can reach your goal?
Right. The infrastructure to actually deliver the vaccine obviously relies upon actually having it. At this point, we're working with the state of California to try to assure that we'll have adequate vaccine to continue this mass vaccination process on an ongoing basis. The state is collecting information in multiple ways and having troubles matching the information that they're getting. But we know that the federal government is increasing the allocation to states by 20%, and we have reason to believe that our allocation will increase also. So we're watching that very closely, and we feel like we have to be ready for the vaccine, ready with the infrastructure, and Levi Stadium's a very important part of the infrastructure.
Great. Next question is with Dan Kerman with Cron.
Okay. Can you hear me now? Hello?
Yes.
Okay, sorry about that. What is Jesse asked part of my question already, which was, are you hopeful the supply will increase? And you have indicated yes. Do you have a timeline on when you think that 20% will increase? And how many vaccinations at these mass sites, how many mass vaccinations based on supply can you do now based on the current supply? And what do you need that supply go to so you can max out, and what is that max number?
Well, right now we're going to start at 5,000 a day and expand to 15,000 a day is our goal, obviously based on the amount of vaccine that we get. At this point, we have the capacity to last for two and a half weeks, or complete system-wide, with the Levi Stadium operating at full capacity. But we are lobbying heavily for the state to send us more, and I can't give you a specific date, but there's been reassurances that we'll get adequate vaccine volumes to be able to continue. What I clearly expect is that there'll be fluctuations in the number of appointments based on how much vaccine is available, and that will be something we'll be monitoring on a moment-to-moment basis. I should mention that getting an appointment for these sites is important, and in order to get an appointment, you have to go to sccfreevax.org. It will go through a process for appointments, and you'll be able to schedule at Levi Stadium or any of the other county sites.
Great. Our next question will come from Eric Westervelt with NPR.
You have to unmute.
Can you hear me now?
Yes.
Thanks for taking my question. The Pentagon today announced they'll deploy more than 1,000 active duty troops to sites around the country, including some in California. Will Levi be among the places either active duty or Cal National Guard troops will be deployed is the first question. The second, and it touches on some of the questions my colleagues have asked, your press release calls it the state's largest vaccination site, but I believe Dodger Stadium has done 7,000 and 8,000 vaccinations per day, fluctuating, and there are other sites up and running in that number. So how is this the largest? Thanks.
Well, we anticipate it'll be the largest because we'll be doing 15,000 a day. Right now, since we haven't started, it's not currently the largest, but we anticipate it will be. In terms of the question about help from the active duty and National Guard, at this point, we have not received information from the state or the feds about how they will be deployed. We certainly would be happy to have them partner with us or partner at another site.
Thank you. Our next question will come from Chris Nguyen with KGO.
You're muted. There you go.
Great. Hi. Just to clarify, Dr. Smith, 5,000 a day at Levi's and roughly 6,000 or so a day at all of the other county sites combined. Is that accurate? And if so, does that mean that next week the county will be up to roughly 11,000 vaccine doses a day starting on Tuesday? So there's part one of the question, and part two before I get muted again. I was told that people will be able to go inside the stadium to get their vaccine. Can you confirm that, or if it's going to be like a drive-through setup?
It'll be inside. We don't have a drive-through set up there yet. That's still a possibility, but at this point it's inside. We're going to start off with 5,000 a day, and you're right, it's currently 6,000 a day for the entire system. So that, is roughly doubling, and the goal is 15,000 a day, which we will ramp up to as fast as we can. We have the infrastructure, the vaccinators, the team, the ability to do 15,000 a day, but we obviously can't do that until we get sufficient vaccine.
Thank you. And we have time for a couple more questions. We're going to go back to Devin Feely for a follow-up question.
There we go. I've unmuted myself now. The county shifted its distribution policy this week because Kaiser was in the position of having scheduled and then being forced to cancel some appointments. Because we have this uncertainty about the supply of the vaccine, is that going to sort of the available supply, will that dictate the number of available appointments so that we're not in the position of sort of over-promising and under-delivering?
Yes, we find out about how much vaccine we're going to get about a week before we actually get it. And so we release the appointments based on that expectation so that we can avoid canceling appointments that have already been made. The change to accepting all comers and having no wrong door was really based on the realization that Kaiser and PAMF, who are multi-county entities, were clearly not receiving enough vaccine dosages in order to provide to all of their members. And so because it's important from a public health perspective to get the 65 and older population in the county vaccinated as fast as possible, we felt we had to expand our availability and expand our openness to Kaiser and PAMP. Roughly speaking, they together are responsible for about 40% of the lives in the county. And if they were excluded, that would be 40%, roughly speaking, of all of the citizens greater than 65. So that would just be unacceptable.
And for our last question, we will go back to Jesse Gary with KTVU.
It's okay. I'm all good. Thank you, though.
Wonderful. Thank you all for joining us. And with that, we will thank Dr. Smith for his time this afternoon and thank all of you and move to Ricardo Romero Morales for the Spanish portion of our media availability. Thank you very much.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.